Hello and welcome back to Vicky's case. This is the third of four videos that I've produced. This is Dr. Jerry Cuomo here in Boca Raton, Florida. You're now looking at Vicky's two front teeth, the central incisors. We're in the middle of placing a full set of 6 laminate veneers. Incidentally, the laboratory that I work with, and I've been working with for over 20 years, his lab is a lab that's won 2 Golden Apple Awards at the Florida Dental Cosmetic Association, or part of the American Academy of Cosmetic Dentistry. And his name is Toby Nielsen from Nielsen Dental Studio in Deerfield Beach. And if you need any information about his lab, feel free to call me. Right now I'm cleaning up the excess cements that are in and around the 2 central incisors. We want to do that first, so I'm taking a number 12B Bard Parker scalpel, and we're going to just go in and cleave some of that excess without touching tissue. A little bit of the tissue is somewhat red, you'll notice on the right side there, but that's basically just a cotton cord that's protecting that interdental papilla. We did go subsulcular on this case because we wanted to produce enough pressure to the interdental papilla to close any of these triangular areas or black triangle spaces. So taking full advantage of the preparation now with the laboratory also on board. That's also quite versed in this technique. Again, the type of porcelain is called Design Porcelain. That's D.SIGN, Design Porcelain by Ivoclar. Highly recommended if you're going to go feldspathic today. Also, you have your pressables. Here we are just looking at the other preparations and getting ready to seat them next. So we're going to go ahead and etch the surfaces. Again, I'm using a 37% phosphoric acid and in the company's own pre-comp syringe. Those tips I use are from Ultradent. They're red color Inspiral tips, and they allow that material to extrude very beautifully. There's a little brush tip on the end of that, and being very kind to the soft tissue. Things are working out pretty well here for her. She's very comfortable. We got nice alignment of the 2 central incisors. And we're going to move right to the next step. So you're looking at this video in real time. It was pre-recorded, obviously, in order for me to do a voiceover like this. I've saved this video to make as both for patients and dentists to actually view what a severe case of staining and malalignment of teeth, crooked teeth, and now we're going to give her a beautiful smile. So for patients as well, if they want to come in and get another opinion about veneers versus crowns, feel free to do so. I'll be happy to talk to you on the phone about that. We've done that with other patients as they call in from all over the world, and there's no charge to that. We'd love to help both you and your dentist out and coming up with an optimum level of care in the cosmetics of dental veneering. So now what we're going to do is treat the surface with another chemical called tubulacid. It is a chelator, so we want to open up what we call dental tubules. And starting to get an education on television now. They talk about how the tubules are sensitive and how to treat them. These tubules need to be opened up first, and then we seal them properly with the adhesives. And now we're going to move right ahead with painting on the surface the primer. This seals up the dentin, so the patient doesn't have any sensitivity to cold later on. It also increases the bond strength of the bonded adhesives that we use. Again, I'm going to use products that match the ceramic. I don't like to use products that that don't match the ceramic. Ivoclar has been around for many years, and their company has matched up their ceramic with the adhesives, so we're going to do that. And then in this next part of the video, we're using that air syringe, absolutely filtered twice, one from the where it comes out of the floor and also right at the hookup in the dental unit, so there's no moisture whatsoever coming off that air syringe. It's very important that you don't have any air, or excuse me, water contamination. So again, that's another company here in Florida that can ship you direct on that filter system. Terrific to use it. I don't have problems with the cases. We do warranty each case in dentistry here on a pro rata over 10 years. So we would be happy to do that with every case. So we do warranty for 10 years. If you were to chip a veneer, that can either be repaired easily with composite, or we'll just remake the veneer itself. With every veneer case, I will suggest a bite guard as well to use at night, so that you can protect your teeth from any grinding or what we call bruxing. So light curing is important. We want to make sure the surface is sealed properly, and before we go to the next step, and that thinning process is so important to get the proper fit of the veneer itself. So under the microscope, everything is checked, including margins. Now we're applying the two veneers on the left side of the patient, and we're cleaning up with the rubber tip stimulator, just removing that gently. My dental assistant is just wiping that instrument for me as I go back and forth, and finally we'll tack these two in, go through the cleanup, apply the air barrier layer, and then light cure the case. So that oxidation, anti-oxidation surface barrier is important. I'll show you how we place that add on the tooth. So cleanup is important. The more you do now, the less work is to be done later. Although it's very meticulous removal, you have to be very careful not to dislodge the veneers so that they go back in place properly. We'll book for a full case of veneers a full day. Here we're just in the morning. We start at 8, end at 12. If we go past 12, we may stop, order lunch, if there's some cleanup that has to be done for the patient. Full upper and lower veneer case would take all day. I would say from 8 to 12 in the morning for the upper, and 1 to 4:30, 5 o'clock for the lower. Cost for these cases are probably the more premier cost per case. It all depends on each case. We look at the severity, the amount of time, and also the type of laboratory work that we need, and who is doing the case is important. We have basically 2 labs that we use for all of our dentistry, and so anytime it's cosmetic, you're going to see that the fees are going to be somewhat higher. So again, call us here at the office at 561-391-6290 for any further information, or come to our website at www.gcuomodds.com. That's spelled GCUOMODDS.com. So we're getting in here, we're flossing with glide floss and just going through the contacts now, and further the cleanup, and getting closer now to adding that air barrier. It's like an antioxidant or oxidation gel that goes over the margins, and then we light cure each side. Now we'll have 2 bonding lights focused on each side, simultaneously curing the veneers in place. And again, we're just making sure that we have enough of that air barrier material that comes with the kit. Now, dental assistant and I are going to cure from both sides, so 2 wands at one time. Go ahead and cure that for 40 seconds each tooth, and then move on to the next step. So again, this is Dr. Jerry Cuomo. We'll see you on the final clip of the series of 4 on the dental veneers, and try to make your life easier. Certainly ours is very gratifying with these cases. So see you on the next clip. Take care.